Hello, I'm Dr. Katie Deming, and welcome back to Born to Heal. As someone who teaches about the importance of creating space for healing, I know how essential it is to practice what I preach. So we are taking a break in August. This gives myself and my team time to recharge and prepare for some exciting things coming your way this fall. I wanted to leave you with some of our most popular episodes and a few conversations where I was guest on other shows. You'll hear powerful stories of healing and practical tools you can implement in your own life. And if this podcast has been helpful to you, would you consider leaving a review on Apple Podcasts or the podcast platform you use? Your reviews help us reach more people who could benefit from these conversations about true healing and wellness. I'm grateful for this community we've built together and look forward to reconnecting with you soon. Until then, take care of yourselves. And remember, you were truly born to heal. I would say that everybody has that voice inside and knows what is right for their body. And even with all of the experience that I have of, very deep knowledge of conventional therapy and then coming out and spanning the spectrum and, going completely natural, I don't know what is right for you. Only you know what's right for you, and trusting that little voice, trusting something inside of you is saying, nope, this isn't right. This doctor's not for me, or this treatment's not for me. Trust that.
Welcome to Metabolic Matters podcast. Let's meet today's guest.
Welcome back to another episode of the Metabolic Matters podcast, where we explore the intersection of science, spirit, and systems that shape our health, from the soil beneath our feet to the cells within our bodies. Today, I'm very much looking forward to having a discussion with a fellow changemaker in the world of oncology, Dr. Katie Deming. Dr. Deming is a board-certified radiation oncologist with over 20 years of clinical experience. Dr. Deming is not only a highly respected physician, but also a pioneer in rehumanizing medicine. We'll talk more about that in a moment. She's also the founder of Make Merry, a line of healing garments for women with cancer, and the voice behind a movement in the realm of mindfulness, compassion, and authenticity, bringing it back into healthcare in general and cancer care in particular. Today, we're going to dive into what it means to truly care for patients beyond the diagnosis, exploring the sacred space between science and humanity, and the importance of addressing trauma in the healing process, and how we as practitioners can show up more whole and connected in the care that we offer. I can't wait. This is going to be a conversation that is heartfelt, hopeful, and deeply human, just like Dr. Deming herself. Let's dive in. I just want to welcome you, Dr. Deming, for joining us today in your busy schedule. Thank you for being here.
Thank you, Dr. Winters, for having me. It is truly my pleasure to be here.
It's really fun. I was saying before we started the recording that I knew we were going to have this conversation, and I knew of you, and I remembered your name comes up a lot. And I just needed to go and remind myself of a few things, and realized I actually learned about you quite a while ago when I saw you first on your TED Talk. When did that get published? Was that 2 years out? Just over 2 years now?
So it was released in June of 2022.
Gosh, okay, 3 years. Goes so fast. But when I saw that, you guys, I'm hoping we'll have this in the show notes today, but you have to go watch this, because I'm watching this video and I'm thinking this person is, first of all, I would like to be friends with this human being in the real world. Number one. Number two, you speak so to my own heart and soul as a previous patient dealing with cancer, who I also very much struggled with some wording and some languaging out there, which we'll touch on here in a bit. And just the way you present it, you are so heart forward. It's just really beautiful. And I just was very touched by you, your story, and your sharings. And I see that you're doing amazing things in the world. So let's start by giving everybody a little background, because I'm kind of queuing us up for part of our conversation here in a moment. But wow, you have gone from a standard of care, conventional trained radiation oncologist, which, I've met a lot of radiation oncologists in my time, and most are literally getting in, getting out with the patient very quickly. You have a very short window. You typically are with the patient. It's a very different than even the med oncs or the surgical oncs. You have a very sometimes limited role as far as bedside goes. But this seems to be what you're all about today. So can you tell us a little bit about your background in your training and maybe what was the moment that said, I should be bringing more to the table than just some radiation support?
Sure. So I did all of my training, my medical training at Duke University in North Carolina. So did medical school, internship, and residency all there. And then I moved to the Pacific Northwest. I'm actually originally from California. And so it came closer to home, but ended up in the Pacific Northwest and practiced there for 20 years, actually. And I practiced as a radiation oncologist, specializing in breast and gynecologic cancers. And I also served as a healthcare leader. So I designed and led end-to-end cancer care for a healthcare organization in the Pacific Northwest. And, for me, there are kind of multiple moments where things started to, now in retrospect, I can see where things started to shift. But I'll just tell you in 2018, where I started to just really sense like something is wrong here and something like I didn't know what the answer was, but I was starting to see the problem that I hadn't really seen before then. And it happened when I was at a meditation retreat and I heard the parable of the river. And it goes something like this, that once upon a time, there was a village perched alongside a river. And one day the villagers noticed a person drowning in the river. So they sent a villager out to rescue the person, bring them onto dry land. And then the next day there were 2 people drowning in the river. So they sent 2 villagers out to rescue the people and brought them to dry land. And then the next day there were 4, and then 8 and 16 and so on and so on. And it doubled every day. And the villagers became very organized in their rescue operations. They developed elaborate rescue teams and they had boats and pulleys and all of these things. And they were doing such an amazing job at rescuing all these people who were drowning in the river. And the village elders were praising the villagers at what an amazing job they were doing. And I remember at the moment when I heard that of the village elders praising the villagers of the amazing work, I looked at my colleague who was a GYN oncologist and I said to her, this is us. Like, this is 100% us. We are glorified rescue workers on the river. And what the heck is happening upstream? Why are so many younger patients walking through our doors? Like when she and I started practicing around the same time in 2006. And at that time, most of the women that I treated were in their 60s and 70s is kind of what you would expect with breast and gynecologic cancers. But it was shifting and we were seeing younger and younger women. And so that was the first time where I just thought, gosh, there's a problem here. And also, in Western medicine, like 5 to 10% of cancers are related to a genetic abnormality. And so 5 to 10% of the time we could say, yes, there's some genetic abnormality that's related to this, but 90% of the time we were saying, I don't know, it's bad luck. And to me, that was so dissatisfying, right? So with this village parable, I was like, and not only do we not know what's happening upstream, but by the way, when we put these people on dry land, when they finish their radiation or their surgery or chemotherapy, we don't know what made them sick in the first place. So how do I keep them from falling back in the river? And so that was like my first, and I was thinking about this from a healthcare leadership perspective of really looking at, I was working in an organization where we owned end-to-end care from screening and prevention. So you really have the potential that you could shift this, right? But I was seeing like, oh, something is really not right because even when you own the whole end-to-end, like we don't have a grasp of what's really going on here. And so I started having these messages actually that I was not supposed to be practicing radiation oncology anymore. And it made no sense to me because I had trained my whole life until I was 32 to become a radiation oncologist. My first job out of training, I was 32. And so when I started telling my husband, I said, I'm having these weird messages, like I'm not supposed to be practicing radiation oncology. And I had an apparel business. So I actually have a patent on a product for women with breast cancer. And I designed a line of bras and camisoles and underwear that were super soft, designed for women with radiation skin reaction. And I knew that I wasn't going to go like be an apparel designer. That wasn't what I was like. These messages weren't about that. I knew that, but I was like, I don't know what I'm meant to do. And when I told my husband this, he was like, well, you have everything someone could want. You have a meaningful career where you're helping people who have cancer. You make a great living. You're good at your job. Your colleagues love you. Your patients love you. And he said, this is something that now I know is not correct. But when he said it, I took it, internalized it. He said, maybe if you're not happy having everything someone would ever want, maybe there's something wrong with you. Maybe you're never going to be happy. And so I internalized this for a little while. It allowed me to ignore the message for a while, right? So I was like, okay, I'm going to ignore these messages because it doesn't make logical sense. But what happens when we ignore messages? They keep coming, right? And then it gets louder. So what happened in 2020 was, and actually this was right after I had just been nominated to become the national medical director of all of cancer care for Kaiser Permanente.
Wow.
And had gone through I don't know, it felt like 6 months of interviews. Maybe it was shorter, like 4 months or something, but I had done all these interviews and it had come down to me and one other woman who was a researcher. And ultimately she was the one who was awarded the position. And I knew when that happened, I was like, I know I'm not meant to build something in the system. I just knew. I was like, this is happening for me. This is absolutely what's supposed to be happening here. And the next week I had something called a shared death experience. And this, a lot of people know what a near-death experience is, but this is different in that the person who has the experience is not the person who is dying. It's actually someone who is at the scene where someone is dying. And it can happen to healthcare professionals. And so that happened to me the week after this whole interview process had finished. And I had this clear, knowing that I wasn't supposed to build something in the system. And then I had this experience. And the only thing that I can tell you is I went outside the veil, like the love and the light and the ineffable just beauty of whatever is real. This, I think our perceived reality is not what's really going on. But when all of that fades away, it's just so beautiful and so much love. And that changed me, actually having had that experience and being bathed in that light. When I came back to myself, I was different in some ways. And I can't explain what that was, but the thing that I knew I had to leave. I had to leave the system. I had to leave my position as a radiation oncologist. I knew that those messages that I had been getting for a year were real and that I couldn't ignore them. And I also knew that it probably was going to mean the end of my marriage because my husband didn't understand, just could not understand the idea of just leaving and not having a plan. So basically I had to make the decision that I was like, okay, I see it. Now I have to do something with it. And because I spend so much time around people who are facing their own mortality, I do know what people say at the end of their life. And the biggest regret that people have is that they didn't have the courage to live their truth, that they did what everybody else wanted them to do. And so when this shared death experience happened to me, I knew that if I didn't follow at the end of my life, I would be regretful. And I knew that I couldn't do that. And I said to my husband, I would do anything for you, but I won't betray myself. Right? Because we leave here alone. We are accountable to ourselves or how we lived our life. And so then that just set me on the course of deciding to leave Western medicine, not having a plan. And I actually did that intentionally because I didn't want to jump into another training program and start getting indoctrinated into something else. If there was something not quite right with the system, I wanted to get outside and be able to see, okay, what is it that I'm missing? And so that's really what led me out on this path. And then ultimately, a year and a half later, after really doing my own healing and a lot of time researching what makes us well as compared to everything that I'd been taught about what makes us sick, right? Is what is allopathic medicine. I launched a practice that is more holistic, and I span the spectrum because I have a very deep knowledge of conventional therapy. So I don't want to like lose that. I like being able to help people who are wanting to have conventional therapy, but then I really span the spectrum to people, I help people who don't want to do any of that and heal naturally as well.
Wow. I mean, just a huge wow. Just before we leave onto a different topic, I want to go back to that shared death experience piece, because it clearly, you had several inflection points along the last couple of years of your life, but that one was just so significant. I'm assuming, and maybe I'm assuming incorrectly, that as a radiation oncologist, you had probably been on several deaths, if you will, been present with or for. How was this one different for you?
Well, the interesting thing was that my shared death experience was different in that I was not actually in physical presence with the person. So normally that's the description that people give, but it can happen actually at different locations. And so I'll just explain what happened. And I had been basically one evening, I was meditating and I heard a woman's voice. And when I heard her voice, she said to me, I can't let go. And it's not because of me, it's because of them. Instinctively, I knew she was dying and I knew she was talking about her friends or family. And so I just started talking to her and I said, there's no rush. You'll know when it's time and I'll stay with you. And so then I just sat with her. And at some point in the meditation, I saw that this was a woman named Misty. And I was not Misty's doctor, but I was connected to Misty because her best friend from childhood was an administrator at my hospital. And I had been helping her friend care for her, like making sure all of her wishes were granted, that she could be at home, that she didn't have unnecessary treatments, and also coaching my colleague on losing a friend when they were both in their early 30s. Both Misty and her best friend were in their early 30s at the time. And so just coaching her through that process of the grief and the loss. And so I saw that it was Misty at some point in this meditation. I just stayed with her. And then eventually at some point during the meditation, I started to feel like a pulling of basically now what I would describe as her soul pulling away from her body. And I heard these pops, like pop. And then after the last pop, the sky opened up and just I basically feel like it was like being in the sun. That's the best way that I could describe it. Like being engulfed in the sun. And all of a sudden she gasped. She was like, oh, it's so beautiful. And I could feel the tears streaming down her face of the beauty. She was just like, I never had to worry. And then she was gone just like that. And I was in this space and just bathed in this love and this light. And it was beauty beyond anything I could even describe. And I don't know how long I was there because time doesn't exist in in these realms. And so at some point I come to, and I was like, what was that? Like, wow, like what was that? I literally had no idea, had no reference for it. I had never heard of a shared death experience. And also I wasn't even in location, so it didn't make sense if I had heard about it. So I went to sleep and I didn't tell my husband what had happened because I was like, he's going to think I'm crazy. Like, I don't know what just happened. And so I went to sleep. And then the next morning when I woke up to a text from my colleague saying, thank you for helping me with Misty. Misty died last night. And I said, oh yeah, wow. I was like, I knew that. I was like, but I couldn't tell her because I was afraid like she's going to think I'm crazy, right? And also I didn't want to upset her. She's grieving. So I said, I'm so sorry for your loss. I said, I know this is a weird question, but what time did she die? And she was pronounced dead within like a couple minutes of when that meditation had ended. And I know that happened to give me confirmation that was real of what I had experienced. Because otherwise I think I might have brushed it off and be like, I don't know what that was. It was life-changing, but I didn't have any context for it whatsoever before that.
Wow. So no previous experiences with kind of what some would perceive as the supernatural, the esoteric, or the new age. You had a very unique, out of nowhere, not planned, not intentional, not hopeful. Like, I really hope I had this experience.
No.
It just came to you and through you. Wow.
Well, and in fact, I would say I was nervous. I didn't want to tell anyone that it had happened.
Right. Wow. Interesting. Well, first of all, I'm so grateful that you shared that experience. And, without going in, as someone who's been very present with people who've made this transition, I've had similar experiences. And even the way you described it, I was feeling the physical memory, and that experience that you're talking about. But I've always had dreams of that, but I've never been like in a lucid state in the midst of a situation. I've been on plenty of moments with people when that happens and have felt it in real space, but it's just really beautiful what you described in this sort of no space-time linear experience within not even being in the same place. So I hope that what people hear when they hear this is that we actually all have the ability to tap into this, whether you do it knowingly or unknowingly. And that also, Dr. Deming, what I think is so beautiful is it sounds like it shifted. It helped you cut your own tethers, sort of pop your own tent, stakes that you were kind of hearing pop as Misty transition. But it sounds like it also gave you permission to fully transform into your own life.
Yes. Well, it was definitely that wake-up call. Like, I knew that I had been ignoring. This was like the big message, like, hello, wake up. And I knew that if I continued to ignore, I didn't want to know what would be the next lesson to make this clearer for me. So yes, absolutely. It was life-changing because I knew what I had to do after that.
Amazing. And and again, I'm making some assumptions. You're teaching me as we go along here. Had you been working in the integrative or functional medicine space prior to this? So you were very, cut of the cloth standard of care.
Oh yeah. No, 100%. I was that and then an inventor, so I was very much in the standard of care Western space. And, the way I describe it too is that it's like, I don't know who said this, but it's so true that you can't read the label what's on the outside of a bottle from the inside. And so I needed to leave the system so that I could really see it all the way around. Because when you're inside, you're so invested. And so you're tied up in all the infrastructure and everything that makes it run. So you can't really see things objectively until you get outside. And that's what my leaving was about, is I realize now is that I needed to be able to step outside so that I could see it more clearly for what it is. But then it just shifted completely how I thought about healing, obviously, once I stepped outside.
I love it. And one of the things I think is really beautiful that you have alluded to here and also other interviews that I've heard you do, you did not throw out your training. It's still very much part of you. You've just added more nuance and more layers and a deeper understanding through your own lens to what you already, like you said, you committed so much of your time, your energy, your resources, your expertise to. You just developed your toolkit even further, really.
Exactly. Totally.
Amazing, amazing. Well, I've alluded to this TED Talk that I'm hoping everyone will rush out and listen to, probably 18 minutes of one of the most beautiful conversations I've heard in the realm of cancer, just, topics in the TED Talk space. So I want to applaud you there. But the things that really resonated with me, first of all, I hope that you tell the story that you share of your mother in that TED Talk, which I think is fascinating. But the piece that really caught my attention then, as well as when I listened to it again, is language matters. Semantics matter. And the way we frame our language to whomever we're speaking with matters. And one thing that really stood out to me through my own journey, I have been one of those folks who feel like fingernails going down a chalkboard when someone tries to call me a survivor. And I think that's one of the things that drew me into you the most when I first heard your TED Talk was I'm kind of a little bit like assertive or aggressive when that comes up to explain it. And one of the things that I had to listen to again was that you explained that, and this is so true, that when we use the term survivor in standard of care, we're speaking to the moment somebody's diagnosed to the moment they pass on. It's sort of this weird bumper or guardrail defined space. And it really kind of tries to hover over and define someone or create certain boundaries that are not, I guess, true boundaries. And so I found that very interesting. And then you kind of went through a few other examples of what the connotation of survivor means. I'd love for you to speak to that research. I thought that was fascinating. And then even the way you show up, because I also really appreciate that you also said there's not a single way to phrase it, that you really have to meet somebody where they are and ask the questions of how they need to be spoken with or spoken to. So can you give a little bit, I know people are going to go listen to this, but from that, maybe talk about the word survivor and some of the research you did, and then perhaps share how that really brought your mother right into the fold of this conversation.
Sure. So this topic actually was not on my radar at all until as a healthcare leader, and we were redesigning the cancer care program at my organization. And whenever I designed, I always had patients at the table. And actually that was rare at the time. So this was back in 2013 when people didn't have patient advisory councils, but I had an advisory council that had patients and caregivers who were experienced in the care. And that was really important to me. So we were having a meeting with the patient advisors and we were talking about the survivorship program, which survivorship program for your listeners is just basically the care that is, it's a description for care after someone has completed active therapy and now they're in surveillance. They call it survivorship. And one of the women, the advisor said, I hate that word. And I was so confused because I was like, what did I say? Like, I was like, what word are you talking about? Like, and she said survivor. And oh my gosh, all of a sudden I'm like, oh my gosh, how many times have I said this word? And what's she going to tell me? Like, I hadn't thought about it, that this could be upsetting. And she said, well, first of all, this survivor clinic that you're talking about, I never get to go to because I have stage 4. And when you have stage 4, you're never going to get to go into the survivorship clinic. And I was like, ouch. It's like, yes, she is so correct. And then she said, and by the way, you call me a survivor and I'm going to die with my cancer. So how is that fair? Like, how do you get to choose to call me a survivor when I'm not going to survive my cancer?
Wow.
And then what happened is that around the table, people started speaking up and saying, you know what? I also don't like that word, but I don't like it for a totally different reason because I had DCIS and I feel like I didn't deserve it. And then it makes me feel guilty. And so all of these different opinions started coming out that I realized there's something here to study. And there are other publications that have been done looking generally like what are people's impressions of the term survivor. But I gathered colleagues that I had from around the country, and we ended up doing a study with Susan Love's Army of Women. And so it was with women with breast cancer and looking at their opinion of the term survivor. And the actual opinion, whether it was positive, neutral, or negative, was just slightly positive if you took everyone in the average, which was similar to other data sets. But when we asked why they felt the way that they felt, the data was very rich, but it was all in the comments. And what we found was that 60% of the comments were negative about the way that the term survivor made them feel. And so we started hearing all the things exactly like what I heard in that, that table with all the patient advisors was, stage 4. It's like, how dare you call me a survivor? Or I don't feel like I earned the term survivor, or using the term survivor makes me feel like I'm tempting fate. And you just realize that for me, what I realized through that study, which seems like a no-brainer, like how did I miss this? But of course we want to use one label to describe, how many different types of conditions is cancer? Like, sometimes people say 200, sometimes people say it's like 800, right? It's so many different things. How could we ever think that using one label to describe such a diverse group of people would ever be a good idea, right? And also different stages, different types of cancers, curable, not curable, all of these things. And so for me, it started to open my eyes to what other language are we using that's potentially problematic. And, the battle language is just everywhere in the cancer space, right? And when you think back, actually, a lot of this, started with Nixon's war against cancer, right? And it makes sense actually from that standpoint. If someone's trying to lobby support for a political agenda, you want to incite fear and emotion and all of this stuff, right? And then the nonprofits, don't get me started on nonprofits in the cancer space. I don't even know what to say, but they are trying to sell things, right? They're trying to raise money for whatever it is, whether, it's good or not good, what they're putting their money towards. They are in the business of fundraising. And fundraising, you want to pull on people's emotions, right? So using battle language in those settings makes sense because they have an agenda. They're trying to sell an idea or have people donate money. But the problem is that has just infiltrated into all levels. Like the doctors use the language, patients use the language, family members, friends, and it's activating from a sympathetic nervous system standpoint. If you think about that, I gotta battle, and do the, good fight. And then what if I choose to not fight? Then somehow that makes me a loser, right? So there's just all of these things that it's so loaded. And when I started looking at it, I'm like, of course this makes sense. But I think the thing that I took away from all of that is that I don't know what the language is that's right for you, but we absolutely should not be using these blanket, battle language or the term survivor for anyone. And that each person should be able to choose what language feels supportive and empowering for them, because someone may like that battle language. It may really energize them, and great. If that is for you, I am so happy. But I don't want to use that language if it's going to make you feel bad, or that it is basically putting you in a position where you feel like your nervous system is being activated. As a doctor, my job is to calm the nervous system, is to help people heal, which happens in a state of parasympathetic activation and rest. So that's kind of the big thing of my TED Talk. And for those of you listening, it's just 12 minutes. So that's good. It's not the big TED is 18 minutes. So good. It's not that long. So 12 minutes is not too long. But the beautiful thing that came out of that was that my mom happened to be diagnosed at the same time, the same weekend that I was given my TED Talk and started preparing for it. My mom was diagnosed with cancer. And what was interesting is my biggest fear around public speaking was becoming emotional while I was speaking, because I had given a keynote talk a couple of years before, and I had become emotional. And I realized I was I don't like that, to become emotional in front of people. So then I was I can talk about cancer on a TEDx talk, no problem, right? Because that was my thing. But all of a sudden, here I was, not only a doctor who my career has been oncology, but now it was my mom. And so I didn't know whether I was going to weave that into my talk or not. And I didn't know how it was going to happen. But ultimately, what was beautiful is what I was teaching in that talk was how to empower your own experience and how you want your family and your loved ones to use that language. And so I had shared with my mom what I was learning and what I was planning to teach in the TEDx talk. And what was beautiful is my mom actually told my sister and my niece how she wanted them to be talking to her. And I heard about it third hand when I was having dinner with them, and I was telling them what my talk was about. I was like, oh, it's about battle language and this and that. And my sister and my niece were like, oh my gosh, okay, now it makes sense. Because grandma just said this to us, she doesn't want us battling. She's healing. And that she just wants us to love her while she heals. And I was just oh, so beautiful to have that touch her and then touch my own family so personally.
Yeah. And actually, one of the most beautiful parts of your TED Talk is your emotionality, is your authenticity of letting us see the tenderness and the sweetness of sharing that story. So beautiful. I think that's what you're speaking to, is just this level of authenticity and vulnerability within each of us, and finding sort of the inroads in to how best to engage or activate that healing part of ourselves. So I just think that was so extraordinary. And, also before the recording, because I didn't know and had not met you until in this context until now, I checked in on you about your mom and wondering how she was doing. And I'm curious, as someone who's also an oncologist, especially who had an expertise in gynecological and breast oncology. I want to know how it filters through your being when you lose people, even when they're healing into dying, which I'm certain from the stories you've shared she did. But when it gets that close, like, is it different for you coming through, quote unquote, a stranger versus a loved one? And how do you metabolize that?
Yeah. Well, so what I shared with you that the audience may not know is that my mom passed just 10 months after her diagnosis. So she passed in January of 2023. And, a couple of things that I'll say actually that I learned so much through this process. But number one was that this was her experience. And so I needed to be there for her experience. And I needed to not bring my own agenda. Even though I felt like I had, lots of knowledge that I could share, it needed to be what she wanted to hear. And I needed to bring it in ways that if she wanted it or she didn't want it. And so that's one of the things that I really, really had to practice what I preached in that experience with my mom, because she made some decisions that I wouldn't have made for myself personally. And then when it was painful, because she ended up having very bad pain control. And it's like one of those things where you're watching and you know what's going to happen. And you say, okay, this is what possibly can happen, but then you have to just let go. And so it was really hard. It was really hard to watch my mom suffer unnecessarily in ways that I think were preventable. But I also understood that she needed to do it her way, and I needed to allow that. And I think that that's one of the things that I really teach clients and caregivers is that when people come to me and they said, oh, my sister was diagnosed with cancer or, whatever it is. And I always say, you need to have your own support system so that you can get your needs taken care of. So you are not putting that on the person who is sick because they have so much already. And then also, even if you know something that maybe they don't know that you think can help them, you have to really be respectful about what they're open to. And so that I think was the biggest lesson, honestly, so humbling. But with her passing, what was interesting, and you talked a little bit about this when you're saying, I think you got messages and dreams, but I get messages and dreams. And actually that's how I knew my mom was dying, was actually I started having dreams that I could see that like there was dead tissue on her chin in one of these dreams. And I could tell that the cancer had spread. And sure enough, the next week her scans showed that the cancer had spread. And it was a really, I understand how cancer just really rocks people's world in a way that, I can do this every day. Like I've cared for over 5,000 patients, but you just don't know until you're on the other side and that helpless feeling of someone that you loved being sick. But she ultimately used medical aid in dying.
Wow.
And what's interesting is I live in a state, so I live in Oregon it's legal for medical aid in dying. And I have helped, even when people get the prescriptions, most people don't end up taking it. So I've written the prescriptions, but I've only ever had one person take it. And I was with her at the bedside when she took it. But my mom chose to do that. And actually, I couldn't get there in time. Like she ended up being in so much pain and just wanting to make it happen that it happened when I wasn't able to physically be there with her in person. But I think this actually speaks to the whole shared death experience. Remember how I was saying most of the time the people are in person, but actually I'm not sure if I was there in person attending to someone that I could have that out of body because I would be so consciously paying attention to them, right? But the beautiful thing about my mom's experience was that I knew about when the hospice nurse was coming in and my sister was going to help her take the medication. So I went into meditation and actually I was able to help her. So that shared death experience that I had used that gift again with another patient that I had had. This was probably like 6 months after the first incident, my first shared death experience. I had a patient who was really struggling. She was a young woman with a young daughter, didn't want to leave, obviously. And so she was hanging on really tight. And I was able to help her make that transition in a more peaceful way on the spiritual realm. And so with my mom, I went into meditation when I knew she was going to take the medication. And then it was like, 10 or 12 minutes later, I connected with her and it was her, myself, and Mother Teresa. And Mother Teresa was on one side of her and I was on the other side of her. And, I just turned her towards me and told her how much I loved her and how, everything has happened exactly the way that it's meant to, that there's, nothing to regret, because she was feeling like she had wished she had done some things differently at that point. And so just reassuring her that everything has worked out exactly as the way that it's meant to, and that, that it's time. And so Mother Teresa turned her towards her and then actually unzipped her. So it was like a zipper that she unzipped from her head down. And then as the body started to just gently lower to the ground, this beautiful light just emerged and became one with everything. And that was her transition. And it was equally as beautiful as, the shared death experience I had with Misty. And then the other one that I'd had with my patient, Angela. But yeah, so in the end, in some ways, not physically being with her in person allowed me to transcend this reality and be with her as she made the transition into the spiritual realm.
It gives me such chills because you do speak so much to this other part of ourselves that we often neglect or are even unaware of, that is so much bigger than just sort of this meat suit that we carry around and our intellect that we wield, which you are very clearly competent in those areas. So I just think that it's so beautiful that this skill came through, perhaps even for this moment, so it's just so incredible for that. And, you came from a very standard of care, you started into the functional medicine realm. And even though functional medicine can mean a million things to a million people, oftentimes it's about, testing and giving supplements, but you really gravitated more to a different area in this field, more into kind of the trauma resolution, emotional well-being, vagal nerve, nervous system, repatterning. I mean, am I understanding that to be true?
Yes. I think, holistic healing, it involves all of that, right? And the diet is the foundation. Like you can't do the nervous system regulation and the emotional work unless someone's diet is correct. Because basically they're not centered and they're not grounded. So obviously diet and supplementation is important. But one of the things that became very clear to me when I left Western medicine and started studying what makes us well and what are the pieces that I was never taught about was this whole piece around emotional trauma and illness. And, the first study that really stood out to me was the ACE study, the Adverse Childhood Event Study, of showing that children who have higher incidence of trauma, so any adverse childhood event, which could be divorce, neglect, abuse, sexual, physical, parents having a divorce, parent incarcerated, drug abuse, all of that stuff. Basically, the higher the number of ACEs that they experience, the higher the incidence of cancer, which I was never taught anything about. Obesity, diabetes, cardiovascular disease, lung disease. And that to me just blew my mind. How do I not know this? And I knew it though inside because my practice, I was the only female for a very long time in my radiation oncology practice. And so I got all of the women with trauma history. So I had a whole panel. I mean, I had lots and lots of people in my practice with history of trauma, just because they wanted a female to examine them. And then also I just was more sensitive to that. And so when I came out into this space, that was one area that I realized like not many people were talking about that, at least doctors, like especially within the standard of care for sure, not talking about that at all. And, just helping people understand how are those things connected, and then that you don't have to be afraid of if you've had trauma, but there's so many beautiful tools that you can use and subconscious work. And I just found it to be so beneficial to do that emotional work with people as they're healing as part of that process. But, really I'm focused on the whole picture, right? Because healing is wholeness, bringing wholeness. And that's, mind, body, spirit, and emotions.
I love it. And it's interesting because, you talk about that you weren't trained in this in medical school. And yet in 1991, at the time of my diagnosis, the only information I could find was stumbling across the work of Dr. Robert Ader, who was the sort of coined the term psychoneuroimmunology. So there was research all the way back from the 1960s, the work of Dr. Lawrence Lashan and his work in, cancer as a turning point and sort of the psychological traumas that coincided with somewhere between like a 6 and a 24-month precursor to a diagnosis, and his research that was ongoing. And then I stumbled across from their work, I stumbled into Candace Pert and molecules of emotion and sort of the scientific reality of how emotions impact our immune system, our nervous system, our, inflammatory processes. And then a full 20 years before his book, Biology of Belief, was published, I was reading the research and the work of Dr. Bruce Lipton. And those were the things that I filtered through my own cancering experience. In fact, the first book I read after my diagnosis was a total accident by this unknown Dr. Deepak Chopra in a book called Quantum Healing. And how funny. So it's wild that what blows my mind is that was 1991. You started making this change in, a decade to 15 years later in your own process, but that information has been out there. It just wasn't shared or talked about. And so I love that you brought this in. So could you take a moment and walk us through just briefly how you personally perceive how emotional trauma and energetic imbalances may contribute to a cancer diagnosis and how addressing it might contribute to a healing?
Sure. Well, I love that you brought up Bruce Lipton this is mind-boggling to me. Yes, 1991. This is 2022 so 30-something years later is when I was learning this, which is so embarrassing. And I'm not ashamed to admit it, that we're not taught it, just like we're not taught anything about nutrition in medical school, right? So it's like, it's crazy that this has always been there. It's just what we're taught. So for me, this has been evolving. So Bruce Lipton actually has played a big role in the way that I think about emotions and healing. So psych-k, he talks a lot about psych-k in Biology of Belief. And actually psych-k is the reason why he wrote Biology of Belief, because he was so afraid of writing that book because he was doing stem cell research and talking about the mind as the environment, our thoughts as the environment for the cells was like super out there, right? When he was going to write that book. And so he didn't want to do it because he's like, I'm going to be kicked out of the tribe and made fun of and ridiculed and all the things. And he used psych-k to reprogram his subconscious mind to become balanced around that and become whole-brained around this idea of, sharing this broader truth around epigenetics and how our thoughts affect our bodies physically. So, for me, when I made the transition out of Western medicine, I actually used psych-k as a means for me to shift all of those subconscious beliefs that had been ingrained in me about what cancer was, what I was supposed to be doing with my life, all of those things. And so psych-k had been so powerful for me that when I started my practice, I started sending my clients to the psych-k practitioner that I had been working with.
Amazing.
And the results is what drove me. I just was like, okay, let me see what happens. I'm going to send them because, Bruce Lipton talks about this. And I was like, I don't know, because I told you I didn't go to do some training. I had so much training, but I was like, I'm going to learn this way. I'm going to develop my own art, and I'm going to, learn about the things that are important for me, and then, dive in and do training based on that, but not some big program that's just going to tell me what to do. And so I learned this by watching the results that my clients got by doing psych-k. And it was phenomenal because, trauma, like, people can be in therapy for years and years and years and not make progress on things, right? And in psych-k, you can do 1 or 2 sessions and people will say, I feel lighter. I feel better. And that's really, when someone's sick, you don't want to dig up all their traumas. You want to make them lighter so that they're more likely to heal. So it basically was me really seeing what was working and then, starting to incorporate. And the other thing that's come up for me is German new medicine. And I'm not trained.
Right. Yeah.
Yes. So I haven't done full training in German new medicine, but the idea with German new medicine, for your listeners who may not be familiar with it, with German new medicine, this was created by Dr. Hammer, who was a German internist he developed testicular cancer shortly after his son was tragically killed when he was 18. His son was 18 years old, and he developed this testicular cancer. And he said, there has to be a connection. I was perfectly healthy before that. And he started paying attention to people who were admitted to his ward on internal medicine and seeing if there was a correlation between emotional trauma and cancer. And he saw, yes, there was a correlation, but also there was a correlation between specific types of traumas and specific types of cancer. And he developed this framework that the concept is that when we experience a shocking emotional event, it is perceived by the brain, and then the brain runs a biologically adaptive program to protect us from the shock so that we can survive. And it sends these programs to the organ that is associated with that part of the brain to do something in response. So let's just say it's a separation loss of a woman being worried that her baby is going to die. Well, one of the things that she can do to ensure the survival of the child is to produce more milk, right? And so this is like an example of German new medicine. You experience some shocking conflict of a baby, almost dying, and then the woman develops this tumor in her breast, and it's actually an adaptive response. And for me, German new medicine really helped me think about trauma from a different lens, because then you don't have to be afraid of your body. Like, so many women that I see, because most of my practice is women, is that they're afraid of stress now, because they're like, well, any stress is going to make me sick, and trauma causes cancer. But the thing is, when you understand that, no, your body always is trying to protect you. You don't have to be afraid of living. And obviously we live in a world where there's lots of stress and traumas, big T's and little T's, but it's developing that resilience. And then also working through, when you have a conflict, recognizing, oh, this is an emotional conflict. It's important for my physical health to work through that on an emotional level so that then my body doesn't have to do work to protect myself.
Beautiful.
So I really don't have I know exactly this is how emotions cause illness, but I can say I've found some really beautiful pieces that work. Like psych-k is just a really simple, beautiful tool that can be used. I think German new medicine is a nice way to think about it. If it fits within that context of oh, this is a way that my body was doing exactly what it's designed to do. It hasn't gone haywire or abandoned me or, any of that stuff. So for me, that's, I'm still learning. And I think that there's so much more for us to learn about emotions and healing.
I love that. And I think that, so what you're talking about is kind of pattern recognition and we evolved from storytelling. And these types of things you're describing are ways of understanding our biography and how it translates into our biology. And it allows us to create a new, write a different story or write a different ending to that story based on that information. And so I think that's really powerful. You speak to, don't be afraid of it, not look at it, write a new story with it.
Yes.
Which I think is so, so powerful. And you also spoke to just this treating of the whole being. And one other place that I think we have such resonance is that we really love food as medicine or lack of food, if it were as medicine. Yeah. And you really bring fasting in, and I love it. I mean, my gosh, that was also part of my early strategy accidentally. A full bowel blockage from an ovarian cancer diagnosis in 1991 forced me into fasting, which became an ongoing tool in my life for the past 34 years, right? But it's been a tool that has been really, in fact, we're facilitating a 3-day water fast among our community right now globally. And so it's such a powerful reset. And you don't just use it as a physical or immunological or microbiome reset. You also fully bring out the potential of the emotional and the spiritual reset that this brings. Can you talk about how you integrate this sort of trauma awareness into your fasting programs with your patients and do so without re-traumatizing them along the way?
Yeah. So I started doing prolonged water fasting just kind of with occasional clients who were interested, because I work with a very, very powerful medicine man who teaches healing in the ancient ways. And he's the one who brought it to me. He said, if you fasted he started like small. He was like, if you fast for 9 days, did you know that you could get tumors to start to shrink? And I was like, wow, that sounds crazy. And then the next thing he was like, a month later, he's like, and if you fast 30 days, you could make cancer go away completely. I just did not, it sounded so absurd to me that I was like, that is crazy. Like, who is going to do that? Right. But then he kept bringing it up. And when he's bringing things up, I'm like, okay, I got to pay attention. So then I had a client who was interested in doing a water fast. She was traveling. She had a trip planned, so we could only do 17 days, but she had breast cancer with a brain metastases, and she had had radiosurgery, which is high dose radiation into the tumor bed. And then she started working with me, and we basically changed her diet, did supplements, emotional work. And then we did this water fast. And at the end of the water fast, 3 months later, she had her MRI with the neurosurgeon, and the neurosurgeon was like, the tumor's gone, really confused. And she's like, yay, like, isn't that what you want? Like, she was like, of course, like, isn't that great? And he's like, yeah, but you don't know, this is not normal. So after radiosurgery, you would expect actually at like even up to 6 months that the tumor would be slightly bigger, but less contrast enhancing. And then it would fade over time, but you would always see some tumor in there. And that also you'd get radiation necrosis, which is damage of the brain tissue from the radiation. And her scan was completely clear, like pristine, like as if there had never been a cancer there. And so it wasn't until I saw the scans that I was like, oh, that's why he's confused, is this is not normal. And so for me, I was like, this is incredible, right? It was incredible. And what happened with her was that she had this moment when she got to 17 days where she knew, it was almost like she's like, I felt like I had been struck by something. I knew that it was gone.
Wow.
And also she knew what she was supposed to do with her life. So it was like these two things converged on her at once, where she'd gotten this message like 2 years before about mindset coaching, but she had ignored it because it didn't fit with her current business.
Wow.
And so she basically had this, complete revelation around her career, and then the cancer was gone. And so then I was intrigued, and I was like, okay, can I do this? And then I saw there are other centers that did it. So initially I started sending people to some of the centers that do this, or some of the people who do remote fasting. But the problem was, and I'm going to get to your question about how does the emotional, but this all plays in, is that the refeeding is all plant-based.
Yeah, you got to be really careful with that.
Yeah. So, and I mean, it's fine, right? Because that's what these centers, that's what they're focused on. And that's the diet that they're teaching. But for people with cancer to have their microbiome reset in this beautiful way, and then totally cleaned out and metabolically reset. And then all of a sudden they're drinking like watermelon juice. I'm like, oh no, I'm like covering my eyes. Like, I don't want to see this. And then that's when I realized, I'm like, oh, Katie, you have to do this. Like, you have to actually supervise this, because people who are fasting for cancer need something different. And so that's when I started fasting. And it's only been actually this year in 2025. So I started doing fasting people in groups, and the group aspect is so powerful too, because they support each other. And so, it's with the fasting, of course, the first thing is getting into ketosis, which is amazing. So that's great. And then they start dumping the toxins. So then they start detoxing, like around day 4, usually is like day 4 to 7, you have more of the detox symptoms. But then at day 7, the autophagy sets in where the body then prioritizes disease tissue. And so it flips the script on cancer. We think of cancer as a parasite that's, feeding off the host, which is the human. But when you get into this, prolonged water fasting, you're basically flipping the script, and the body is now using disease tissue like tumors for its fuel. So, that's the reason why I started doing is because of the autophagy. And then I knew with the refeeding that they needed something different. But what's happened with my people who are fasting in a group is the energy is held by my mentor. So my mentor is a very powerful healer. And for those people who are familiar with the Carlos Castaneda books from the 1960s and 70s, Carlos Castaneda was an anthropologist who reportedly apprenticed with Don Juan, who Don Juan Matus was a very powerful sorcerer and shaman, an illuminated being. He performed miracles, an illuminated being. The truth is that Carlos never met Don Juan, and Carlos never apprenticed with Don Juan. Those stories were actually written by a 14-year-old boy who was the apprentice of Don Juan. And that boy is now a 70-year-old man. And that is my mentor. His name is Don Javier with an X. You would never find him on the internet. So if you went to search him, people will not find him. You will not find a person like this unless you want them to find. They want you to find them. But he supports the energy and the frequency for my fasters. And then those who are open to it, he works on their light body through elements. And the stuff that is happening on an emotional and spiritual level for my fasters is way more powerful and valuable than autophagy. And I say that with all due respect, like it's amazing if we can make tumors go away, but to have people overcome their fear, receive messages about what this diagnosis was about, see their light body, like one of my clients actually in the middle of the night, she could unzip her body and watch her light body dance around the room and, receiving messages from God, like get a pen and paper and just these beautiful divine messages. That is not anything I expected, but just been the most beautiful gift, for me to witness.
Well, I love that you're saying like this is your unfolding as well. And these experiences, what you're describing right now, you're only tapping into just this year. And just where will this be a year from now and 2 years from now, 5 years from now, or 10 years from now? I can't wait to see where it goes. But what I think is so extraordinary is something in you opened up in the last, period of time that is allowing you to be a conduit to bring another level of healing, weaving in the best of both worlds of what standard of care and what these ancient healing practices have to offer, things that we were divinely wired to work with, the elements of the elements in general, water in particular. I know that's one of your jams. So I'm hoping people follow you further for there. We might get you back in for more conversations around that topic alone. I love that you tapped into some of these people, these names, these places for people to go read more about, like Dr. Hammer's work, even Carlos Castaneda's writings of the times. This is not new, and yet it's being accessed differently. And maybe humanity is finally ready to hear it or look at it in a different way because we are sicker than ever. And the tools that we had available or that we allowed to be available have stopped serving us in a meaningful way. And so some people may hear this and be like, oh, this really went really esoteric woo-woo. But here, you guys, I need to reiterate, this is a Duke trained radiation oncologist who took her craft as far as it would take her and had some other experiences that helped open her up to more tools to bring to to serve her patients and those that are called to work with her. And so, Dr. Deming, I just want to honor you and your courage, and your own. Like it took Dr. Bruce Lipton 20 years to be courageous enough through the work he did to get his amazing work into the world. I love that it's taken you a condensed amount of time to do the same. I can't wait to learn more and experience more of what it is that you are learning and teaching all of us. And I'm just really honored to have this conversation. And if you had to offer up some sort of, words of wisdom in taking us away from here, first of all, where can people learn more about you and get access to all of your beautiful offerings? And second of all, where might you recommend someone begins to start to tap into their own gifts?
Sure. So you can find me at katiedeming.com. I also have a podcast called Born to Heal, where I bring on experts and share things that I feel like should have been taught in medical school and wasn't. So I bring my listeners on a journey. I definitely don't know everything. I'm learning right along with them. And, what I would say is we are all intuitive, but it's the noise that keeps us from hearing that little voice. And actually looking at Kelly Turner's work of radical remissions, there are 10 things that people who heal themselves without conventional therapy. And one of those things that they do is follow their intuition. And I would say that everybody has that voice inside and knows what is right for their body. And even with all of the experience that I have of, very deep knowledge of conventional therapy and then coming out and spanning the spectrum and, going completely natural, I don't know what is right for you.
Mm.
Like only you know what's right for you, and trusting that little voice, trusting something inside of you is saying, nope, this isn't right. Like this doctor's not for me, or this treatment's not for me. Trust that. And then go find something else. And the other thing that I'll say is that your intuition will often make no sense. Kind of like my intuition was like, you have to leave radiation oncology, but I'm like, this makes no sense. I've been training till I was 32. And so understanding that your intuition is likely not going to make rational sense, but that doesn't mean you shouldn't trust it. And really listening deeply to yourself. If you're on a healing journey, the best thing that I can tell you to do is to listen to yourself and protect that knowing, and really foster it and use this experience to get to know yourself better, because that's what we're here to do.
So beautiful. What an absolute gift that you are. I thank you so much for your time, your expertise, your passion, and your purpose. Dr. Deming, it's been an absolute delight.
Thank you, Dr. Winters. It's so nice to spend time with you.